Hi, thank you for joining us today for a Mary's Place moment. I'm Dominique Alex, the CEO at Mary's Place, and I'm joined today with Ayan Abdullahi, who is the founder and executive director at Ayan Maternity Healthcare Support, to talk about an incredible partnership we have together to support the women and families in our shelters. Would you like to tell us a little bit about who you are and how you came to us?
Okay, yeah. If I tell something about myself first, so I've been working childbirth childbirth for many years, and it's a legacy from my mom before I arrived in USA, and then I got here. When I arrived here, I got the chance to continue my career, and then I started working as a doula for almost 30 years, working with the community. And finally, I found this organization, Ayan Maternity Healthcare Support, because I realized that we need more doulas and we need childbirth education, childbirth workers in Washington State, because we have very rare numbers of this kind of nonprofit organizations supporting community, especially immigrants and refugee and low-income families. Yeah.
So, can you tell us a little bit about what a doula is? Because some people may not know what that is or why it's important when you think about people that are pregnant and delivering babies into our community.
Yeah, the doula is a person always close to the pregnant women and also families and support and advocate. The doula does not provide any medical issues, but we also, and I believe we also do more than that, because the doula is the only person who's going visiting in their homes and knowing more and closing each other and building connection and relationship with the family.
Yeah.
At the beginning, even when she's during her pregnancy. And then also continues after when they give a birth, like postpartum doula, postpartum visiting home. So yeah.
Yeah, so it's really about building that relationship through the journey.
Yes.
And it sounds like more of a coach and that support in a room where you're trying to make sure that you go from that having that labor to that safe delivery and then to home where there's still that partnership and relationship to support a mom through that next phase, which can be really challenging and exciting. So, can you tell me about the type of families that you're serving? So, you talk about different cultures, languages. Also, I know at Mary's Place you've been doing work with us, but also like where families are they housed? Are they unhoused? Can you share a little bit about that?
Yeah, absolutely. The most clients we serve by now is Black women, especially Black immigrants, refugees. We have current project which called Birth Equity Project. So that's an East Africans. So that will allow us to have more Black women and immigrant women and refugee. But in the meantime, we have also a lot of different communities like Dari speakers, Matlani speakers, and also Lingala speakers too as well. Yeah, we have also Spanish speakers as well. So as an organization, we always try to best services as much as we can. So an equality and every person who needs our service.
Well, that's incredible. I want to talk a little bit about our partnership. We at Mary's Place have been partnering with you all, and I'm wondering if you can share a little bit about what kind of services you provide to the women and the families here in our partnership.
Yeah, absolutely. I'm so happy and work with the Mercy Place. I provide doula services whenever I receive referrals for the Mercy Places locations like Bellevue or Seattle. And in the meantime, I do also community education classes, which is maternity education class with the community. I do events for the different locations as well. And at that moment, I feel very happy and when I'm doing this because our classes included maternal mental health, which is very important, and supporting the women who has babies and struggling a little bit, And then we do also for fun, for music and
little community building.
Community building, and we have so happy. And in the meantime, I also provide the doula services, the doula workshop training for free. I offer them. I said, whenever if you are ready to become doula, so we have a workshop or doula workshop training for free, including materials, books.
And so an opportunity for people to gain some skills and hopefully be able to also help other people, but also gain some economic stability too, because there's jobs for people to go into. I'm also wondering, when you talk about education, what are some of the things that you would like for families to know, or that you ensure that they know in the journey, right? Especially for the people that maybe it's their first time being a mom, right? Or they may have some health challenges, right? That they need to overcome. So maybe you could talk a little bit about what education is really important in that birthing journey.
Yeah, absolutely. Yeah, absolutely. Yeah. The other thing is what we do is we create materials, screen tools. So that's very important for the first mom, and also every single mom. She can get education herself. She can take care of herself before she go to the clinic. And we create a screen tool. I have some also here.
You can show us. Want to show us what you have?
Yeah. For example, like this one. This is the Blue Band project. And
this is what this one is here.
Yeah, this is a blue band bracelet. So we have a doula. We have a doula. She's a specific works with the high risk clients. So she educated also this old classes before, and then she trained the client. Whenever we receive any client complication, we go to their homes and we provide. This is very important as a blue band. And though she has to, when she has the experience of preeclampsia or high blood pressure, and then you need to wear this one, and then also we provide this screen tool, and this is symptoms. It has the symptoms of preeclampsia and high blood pressure, and then we also provide for high blood pressure monitor, give to her, and she can take care of herself whenever she feels a headache, or she can check her and she can call the doctor when she had high blood pressure is higher. Yeah, we have also other screen tool, which is all the pregnancy warning sicknesses, and also postpartum depression warning sickness as well.
Okay, so those are important things. So thinking about postpartum depression, kind of preventing people if they have high blood pressure, to be able to know how to take care of themselves or call the right people in that partnership, right?
Yes.
So these are things that you all have brought to the Mary's Place families as well in those education classes.
Yes, absolutely. Yeah, absolutely.
So what can a doula do in partnership with a mom and the medical team that is working with the family?
Yeah, absolutely. The doula is the only person has the same culture and speaks same language, and the doula is the only person who's starting making connection with the client and with the family before she give a birth, and doing home visiting. So doula, she can do a lot of ways. And we are all of us. And we have materials that trying to do and helps as much as we can to reduce mortality health in USA, which is the highest in over 3 to 4 times more than the black woman, more higher than white women. So that's our community. That's what we are doing. And I create this screen tool, so which is complication, pregnancy complication, and also postpartum complication. And we train clients. Whenever we have clients, we do this training and we ask these symptoms if she has, and then say, okay, this time you need to contact directly to your provider. So make sure. And in the meantime, we do follow up. As I told you earlier, we have high risk doula. She's specific, visiting home and advocating and asking if she has appointment, and also follow up every single month, twice or 3 times, continually.
Yeah, just kind of depending on the need, how much time that you need to do the follow-up. But I think that's really critical, right? You've identified that there's something happening that needs support, making that connection to empower the family to work with their provider, but then also saying, how did that go, right? How else can I support you when that doula comes back around as a follow-up?
Yes.
So that's fantastic.
Yeah.
I want to talk a little bit more about our partnership. How did you come to join us here at Mary's Place? What kind of sparked that partnership?
Yeah, absolutely. Yeah, as I told you, I feel like the homeless is very important for me because I have experience as when I fled my country, the house homeless is, staying outside, even they're not houses at all, just on the road,
Yeah.
So, and I feel this is very important, and yeah, and I was trying myself to make connection.
And we're glad that you reached out to us, and we were able to respond because this has been life-changing for women. I remember when you all first started, there was 35 pregnant women in our shelter or had just given birth, a lot of them from various places around the world. And I just remember feeling so much gratitude because that partnership has really been strategic with our health team and the families and providers to understand what the families need and empowering those families to say not only what they need, but what they want. And that it's equitable access to the resources to decrease the disparities in our community, particularly for the women that you have described today. So thank you.
Thank you so much. I really appreciate to give me this great opportunity for me, and also for our community. Every community deserve, every mama deserve to get the best maternal health care. Every mom deserves.
That's right.
Yeah.
Every mom.
Yeah.
Thank you.
So
I appreciate you.